Hello, everyone. Thank you so much for joining us for our insurance terms webinar. I'm so sorry I had some technical difficulties tonight with YouTube. We definitely need to have a streaming software, so I will get that in the works, and then that'll be fixed for next time. But I am recording this webinar and then I will get it posted on YouTube. So if you are watching the replay, please comment replay below and let me welcome you as if I would have during a live webinar. And if you have any questions, please drop those in the comments real time and I will be monitoring those comments and responding to any questions. I just want to issue a quick disclaimer here that this is for educational purposes only. I can't speak to your specific plan or any kind of, estimating what your insurance company might deem your responsibility. This is only to empower you with that education that you need to be able to speak with your insurance company about all of these big terms and understand them a little better. And that way you can advocate for yourself and understand what you're going to owe for your medical services. I also want to insert another disclaimer here that all of the content, real world content that you're going to see is all my information. I did censor out all of the names, including the insurance company name, and I did that to protect my spouse's privacy, since this is also his information on those same pages. And I also blacked out the insurance company name and all of their phone numbers and all that good stuff because everybody's plan is very different. And even if you share the same insurance company with me, your information is going to be widely different than mine is. And so always look on the back of your insurance card or on your portal to gather the information for yourself. But this is just very general, basic knowledge that I'm sharing with you today. So we are Endo Forward Foundation. We are an endometriosis nonprofit supporting people in the DFW area here in Texas. We do support all of the counties around the Dallas-Fort Worth main areas like Tarrant and Dallas County. We support a bunch of other counties surrounding Tarrant and Dallas County. This is my third time recording this because I keep messing things up and not sharing screens and all that fun stuff. So my throat's a little dry and I'm sorry. But if you have any questions, our website is in the upper right-hand corner of this webinar, endoforwardfoundation.com. And we would love to support you or meet you if you're here in the DFW area. Let us know if there's anything that we can do to help you out or answer any questions you might have. Who am I and why am I qualified to bring you this content today? So I'm the president and patient advocate for Endo Forward Foundation. My name is Liz, and you can read my bio here. You can go to our website under the About Us tab. But I have been in the healthcare industry for a very long time now. I actually finished my master's degree last year in healthcare administration, and I recently completed one of my biggest career goals, and that is that I'm going to be a professor in the upcoming fall 2023 semester, educating those that are already in our healthcare industry looking to finish off their education, or those who are entering it and are going to be the future of healthcare. So I'm super excited. The bigger picture here is not of me because I don't like sharing my picture a whole lot, but this is my favorite program that we have going on. And you know what? I'm not sharing the screen again. Let me share the screen. So this is a picture of the program that we have going on that is my absolute favorite. It's our Care Basket program, helping those who have had endometriosis surgery. And we just give them a little bit of stuff that they'll need for recovery or to help get their mind off of recovery. And so I decided to put the picture there because it's literally my most favorite thing that we do. So let's talk a little bit about who Endo Forward Foundation is. So if you haven't heard our story, we were started because I had a very big, heartfelt conversation with my best friend, who is also on the board of Endo Forward Foundation. I had a life-altering surgery because of endo in December, and it really changed who I am. And I have been going through the thick of it. It has been a rough 2023. And I said something to the effect earlier this year of, I just don't get why I'm going through this and why nothing's getting better. And, it's hard. And she said verbatim, "You're going through this because you're the only one that's going to fight to make things better for others in the future." And here we are. The nonprofit has been able to help dozens of people up to this point. We started back in March, and I know that we're going to be able to help so many more. And if you don't know, the average time to get diagnosed with endo is about 8 to 10 years. My journey was much longer than that. And so at the end of the day, if I help you, advocate for yourself and find that diagnosis or rule out endo a lot sooner than that, then I feel like my job has been done, and the nonprofit was, here for a reason. So thank you for allowing us to be a part of your lives and your endo journey and make a difference. Our vision here is to improve the lives of others affected with endo. And we are directing all of our efforts towards fighting this disease on a daily basis. My spouse would probably tell you that it's another full-time job for me because I spend so much time working on the nonprofit. I really love it. We are establishing a supportive network that fosters understanding, compassion, resilience, and paves the way for a brighter future for all of those currently affected by endo or that will find out that they are. I'm going to read our mission verbatim because it's one of my favorite things. Our mission is to provide comprehensive services and education to individuals affected by endo. We strive to empower individuals to take control of their health and well-being by increasing awareness, providing resources and support and education, and advocating for improved access to care. We currently have 4 programs going or about to start. We do have an announcement coming up this week that we are super excited about. So if you don't follow our social media channels and you are in the DFW area, please go subscribe, like, hit the follow button, do all the things. That way you see our announcement coming very, very shortly. And then on the other left side, I just have that 100% of our donations go to running the nonprofit. None of the board members take any kind of compensation for working on the nonprofit. Just a little bit about endometriosis. This is directly from our website. If you haven't been there, I would highly recommend you go. It's in the upper right-hand corner of this webinar. Endometriosis is a medical condition where tissue is similar. I'm going to highlight similar there to the lining of the uterus grows outside of the uterus, affecting different areas of the body. And on the left-hand side, we do have an image here from radiologyassist.nl. And these are images of endo. I'm not going to point it out because I'm not a medical director or a medical doctor. Oh my goodness. But if you want to Google what endo looks like, you might be able to identify where it was in this image, or you might be able to guess. But yeah, endometriosis is tissue similar to the lining of the uterus. It is not the lining of the uterus. Please, if anybody tells you different, there are lots and lots of verified, studied things online that point to the endometrium not being what endometriosis is. And research also tells us that statistically, 1 in 10 people born female have endometriosis. That would equate to about 176 million people worldwide. And if we broke down the statistics to how many women live here in Texas, there would be about 1.4 million people with endo here in Texas. And you might be thinking, oh my goodness, Liz, that is a really big number. I don't know anybody with endo. Guess what? I don't either. I think outside of the foundation, personally, I think I only know 4 or 5 people that would be including me. So on one hand, that have endo. And so there could be a myriad of reasons. Either A, they've been told their symptoms are normal, and so they're living with it. B, they haven't found a doctor that listens to them yet. C, they're awaiting surgery, or, not comfortable to have surgery for that diagnosis or to rule it out. Or D, their endo is silent and they don't even know that they have it. Or they haven't seen any content and they don't know what endo is. And so there could be a lot of reasons, there's probably more than that, of why 1.4 million people here in Texas probably have endo, and we don't really know that many people with it. So advocating, sharing our content, spreading awareness is really important to help somebody who might be suffering in silence, or suffering and not knowing what's going on. Help them see that, there could be a name and treatment for what they're going through. It's good to know why you're here today. All of our insurance terms. So like I said at the beginning, this is just basic education to help you understand and advocate for yourself better. So let's start off. What's a deductible? That is the portion that a person pays before the insurance company is going to pay any portion of that medical bill. It's probably something that you're super familiar with if you've ever had surgery or any kind of major medical expense. You do have to meet your deductible before you pay a copay or a coinsurance, or don't pay anything at all. An out-of-pocket is the total max a person's going to pay out of their own pocket for the year for any kind of medical expenses. So this might be why if somebody like me hears that your out-of-pocket is met, we say, hey, go get all the medical services that you need done this year because it's going to be free. As long as it's a covered service and with an in-network physician based on your plan, then you wouldn't know anything else for the rest of the calendar year. For me, after I had my surgery, I had like 3 days before my plan reset. And so I didn't get to do physical therapy for free. But if you've had surgery at the beginning of the year and you need pelvic floor therapy and your out-of-pocket is met, then you wouldn't owe anything for that, as long as it's with a physical therapist that's in network and a covered service under your plan. Copay and coinsurance get interchanged quite a bit, and I don't really know why, because they're actually different things. So let's go over that just to kind of eliminate any confusion in the future. So copay is a dollar amount set by your insurance plan that equates to what you owe for a service. So it might say you have a $25 copay to see a primary care doctor. You might have a $50 copay to see a specialist, that kind of thing. A coinsurance, on the other hand, is going to be a percentage of the medical bill that you owe for that service. So it might say you owe 30% for a visit with your specialist. You might owe 30% for a hospitalization, but it's going to be 30% of whatever the medical bill is deemed to be allowed. And that leads us into our other term, allowed amount. Allowed amount is the amount that your health plan says that you can be charged for a medical service. And then they contractually remove or discount the bill down to that amount. So if your doctor's office bills $5,000 for a service, but your plan only allows and has an agreed upon amount with them of $300, well, then it would be 5,000 minus 300. They would write off that portion and you would only be responsible for your portion of that 300. If any of that is confusing, definitely drop a comment in the comments below and we can discuss it one-on-one a little bit more in depth. But these 5 terms are super important when looking at what you owe for a medical service. Now let's look at some terminology around medical bills and something that you might have heard. They don't get used as often, but you might have heard them if you're preparing for surgery or getting an estimate or anything of that sort. An explanation of benefits, also called an EOB, is a statement that your health plan is going to send you that just explains how the claim was processed or considered. So they're going to show you any kind of contractual or allowed amounts, the deductible portion, out of pocket, copay or coinsurance, things like that. And we do have an example in another slide. And so you'll be able to see what an EOB looks like. And then skipping over to the right, a super bill. You might be familiar with this term if you've ever gone to an out-of-network doctor or a therapist. And it's an itemized statement showing which services were provided to you by that out-of-network provider. And the insurance company is going to require this itemized statement to be able to consider offering you reimbursement for your out-of-pocket expense with that provider. A CPT code, also called a current procedural terminology code. It's a 5-digit code that standardizes communication and tracking for medical billing. So if you have an ultrasound, there's going to be a CPT associated with that ultrasound, and it's a universal code that's used all over by all providers in the United States that says if they see this code come across their desk, they know that that's an ultrasound. And so that just kind of standardizes all of the billing practices. And then an ICD-10 is going to be the same thing, but it standardizes communication on diagnosis. So if an ICD-10 comes across a doctor's desk for heartburn, it's going to be the exact same thing in Texas as what somebody in New York would have for heartburn. And so it just helps everybody communicate a little bit better on what kind of diagnosis somebody has. And it's important for billing too. The next 3 terms that you're going to be very involved in if your insurance company denies a claim. Authorization. This is an approval, and I say approval lightly because it's very confusing here in a minute. It's an approval from your insurance company that they're going to consider medical services that are being requested. So a lot of plans say if something doesn't have a prior authorization, say that you have to have surgery and your doctor's like, hey, I've got to ask for essentially permission from your insurance company to do this surgery, they would be awarded a prior authorization. And if that's not done, then typically the patient or the doctor are going to be responsible for whatever services were given. So you would be responsible for the whole amount of the claim, because if there's no prior auth on file and there was one needed, then the insurance company isn't going to cover any portion of the claim typically. And that's what it says here. This is not a guarantee of benefits or payments. So if the authorization wasn't done correctly, or you had your surgery the day after the authorization expired, or say that, you know, your doctor's office submitted one thing for authorization and they did another, you know, that authorization may not be any good. It might be null and void. So always just communicate with your doctor's office. Make sure that you know if something on your plan requires prior authorization, and you ask them to get that done in a timely manner. A referral is an approval by a primary care doctor that a specialist visit was ordered and authorized, and this referral allows the insurance company to consider the service. This is going to be very common in an HMO plan, a health maintenance organization plan, and it just says that your primary care doctor is saying, hey, you need to go see a specialist, or you need to have surgery, and I'm referring you over there. And it just tells the insurance company that someone is approving that service. And so health maintenance organizations try to keep costs low. Typically, you're going to pay less for an HMO plan than a PPO. And the reason is because there's a little bit more gatekeeping on services. And while I know it can be really frustrating for us as patients, it is keeping those costs low for that plan because there aren't any wasted services done. And then an appeal is typically filed by you or your doctor, and it's kind of objecting to the decision that the insurance company made to not pay or not pay enough for the services that you received. And every insurance company has their own appeal process. Typically, if you just type it in Google, it'll pop up with whatever form you need to fill out or whatever information they're going to need. And then you could ask the insurance company to please reconsider. Maybe they made a mistake. Maybe something's wrong and they might be able to fix it for you. Okay, let's get into some real world examples. And again, like I said at the beginning, this is my personal information. I did not steal this from anybody. I'm not breaking any HIPAA laws. This is all my stuff. So You might get one of these pamphlets whenever you sign up for an insurance plan, and it's just going to detail out all of the benefits that you have. So right here, what is the overall deductible? So my deductible on my plan is $3,500 per person. And if I'm going to go out of network, my deductible would be $7,000. So that's why, you know, I know within Endo, there's a lot of doctors that are out of network. You can file that super bill and get reimbursed, but most of my doctors are in network. And so if I go all year to see an in-network doctor and I meet my deductible, but then I find an out-of-network doctor, then I would have to pay another deductible. I would have to pay $7,000 before the insurance company considered any kind of claim. And so going in network and out of network, if your plan distinguishes both and separates them, can be really challenging and very costly. Are these services covered before you meet your deductible? Preventative services, office visits, prescription drugs, emergency visits are all covered before you meet your deductible. And so that's where I'm saying if, you know, your primary care visit is only a copay, it might not apply to your deductible, and then you don't have to pay your deductible. For me personally, the only things that I have to pay my deductible for on this plan are an MRI or hospitalization and physical therapy. So any kind of in-office visits or ER visit, I don't have to worry about that deductible. I only have to worry about it for major medical services. And then down here, it has out of pocket. So my out of pocket for me is $6,600. So once I pay $6,600 in medical expenses, it doesn't matter what it is, just, you know, over the course of however many visits I have with however many doctors, I'm not going to owe a dime more. So I'm not going to even owe $6,600.01. That 1 cent would be covered by the insurance company. So after I meet that $6,600, I would probably go, you know, get an x-ray if I need it, or go get surgery again, or, you know, whatever I need to do because my out-of-pocket's met and I'm not going to pay anything else this year. And then down here, it just kind of shows what is not included in your out-of-pocket. Okay, here's just a little bit more of information that you might get whenever you sign up for a plan. So this is going to detail out, if I go to a primary care doctor, I'm going to owe $25 for a copay. My deductible doesn't apply. But if I go to an out-of-network doctor, I'm going to owe 50% and my deductible would apply. And so on. You know, it just kind of goes through there. It also even shows diagnostic test, an x-ray, blood work. There is no charge. I don't owe anything for an x-ray or blood work. It is all completely free under my plan, as long as I go to an in-network provider. Imaging such as CT scan, PET scan, MRI, those are all going to be 30% coinsurance. And then my drug cost down here. If I have surgery, my facility fee would be 30%. My physician's and surgeon fee would be 30%. If I go to an ER, it's going to be $350 copay, you know, so on. You're kind of seeing a trend here. So there's coinsurance, copay, deductible, out of pocket. That's where all those terms are coming into play. Right here, I have rehabilitation services. That's going to be physical therapy. And you're going to see that I have some limitations here. So I'm only allowed to have 20 visits a year for physical therapy. That can run out very quickly, especially after surgery. If you're, you know, seeing a therapist once a week, that's only 20 weeks. If you're seeing them twice a week, it's only 10 weeks. You know, it goes by really, really quick. And then down here at the bottom, you're going to see things that are excluded or not covered under my plan. And yeah. Oh, and then down here at the very bottom, it shows other covered services. So acupuncture, chiropractic care, hearing aid, those are all actual covered things under my plan. Okay, so this is all from my insurance portal, and it's just going ahead and breaking down that information for you. So I have, you know, we have $3,500 deductibles per person. We've met 310 and 378 of that this year. and shows the portion remaining. So I would have to pay, you know, $3,000 some odd dollars before I would be eligible to have the insurance company pay 70% of an MRI, and I'd be responsible for 30. And then down here, out of network, I don't use out of network providers because, like I was explaining, I go to all in-network providers. So if I was to go to one out of network provider, it would be very costly for me. Here's my out of pocket. So $6,600 per person. You know, there's some variability on what's been met there. And so one of us owes 5,000 some odd dollars and the other one owes 6,000. And so after we meet those amounts, we would not have to pay for any other medical expenses for this year. And then same thing for out of network. But you see here, if I were to go out of network, I would have to pay $19,800 before my insurance company would consider anything versus $6,600. So you do what's best for you. But for me personally, I just prefer to stay in network. My portal also shows, you know, my limitations here. So I have 20 visits per calendar year of physical therapy. I've used 3 of those, and just kind of breaks down what your limitations are and how much you've used, what you have left. And this is that example of the EOB I said I was going to show. This is just off Google. It shows Jane Doe or Jane Smith. This is a fake one, but it just kind of shows you what you would be receiving in the mail. So it shows your total charges. If you have other insurance, like a secondary insurance, what they paid, the total amount paid for that. Anything that might have not been covered would then fall to your responsibility, perhaps. Deductible amount you owe, coinsurance you owe, copay you owe, and then the total patient responsibility there. If something wasn't covered or they've made an adjustment or something to that degree, under notes, you'll see like different codes. And if you go to the very last page of your explanation of benefits, you can line those codes up and kind of determine why they made the decision they did on, you know, applying a deductible or not covering something to that degree. And this is going to be a super bill. So like I was saying, if you go out of network, you can submit a super bill to your insurance company with a form that they would provide you to ask for reimbursement, but you would need this itemized statement. So it just shows the date, the CPT code, how many units. So units is a very technical term within the industry. Within physical therapy, if you, you know, do 15 minutes of certain things, for every 15 minutes you do that specific modality or exercise, they would charge you, you know, 1 or 2 or 3 units, whatever it might be. If you received, you know, 3 pills of Tylenol, you're going to get charged for 3 units of Tylenol. There's the fee there, and it'll show if you paid anything, and then you would just send this off. Up here, you're seeing that ICD-10 code, which is showing F41.1, means generalized anxiety disorder. Now let's apply this to some real world situations. So total charges, what my doctor's office said they were going to send off for surgery. This is probably my doctor's charge. So my doctor sent off a claim for $5,350. My network savings, so the agreed amount for 3 charges of general surgery outpatient, my insurance company agreed with my doctor that they will only allow $1,739.76. So this network savings is the amount that the insurance company deducted or contractually adjusted. Sometimes you'll hear contractual adjustment used within the industry. This is showing what my plan paid. And if you come over here, you see that I hadn't met my deductible. So that whole portion fell to my deductible. And because the whole amount went to deductible, I didn't have a copay or a coinsurance, and everything was covered. So you just see another breakdown of those allowed amounts here. Here's another example of that. So total charges, $5,310. This looks like it's for my anesthesia. with the anesthesia company, the insurance company agreed that they're going to only allow $2,112.48. So they've taken care of this $3,197.52 by taking it off the claim. Here you see that my deductible was met with my doctor. And so everything fell to coinsurance. So here you see that here, what the submitted amount was, the allowed amount, what my plan paid. So my plan paid $1,781.46, and I had to pay $331.02. This is another way that a claim might be processed. So if this looks like it's for my hospital stay, and so you're going to see a lot of codes here. So these are all the services I received. So I got, this is probably for my IV, I had some lab services, more lab services. This looks like it's my stay for the room in which I stayed in, and then all of the meds I was given. And so it's just going to break it all down. So it looks like the hospital was asking for $113,133.89 for reimbursement. The insurance company said, nope, the only thing that we've agreed upon is $8,168.97. They removed the rest. And I had a deductible amount here. My deductible had $1,555.22 remaining. And then once that was deducted, then I had a coinsurance. Remember, my coinsurance was 30%. So 30% of $8,168.97 less $1,555 came out to $1,984.02. And then those two added together equaled my total responsibility here. Okay, let's do an example all together. So I've pasted that information here showing that my facility fee, aka hospital room, is, or even surgery room, is 30% coinsurance, and my physician fee is also 30% coinsurance. And remember that both of those deductible applies first, and then once the deductible is met, then the coinsurance is applied. So I've got the deductible here, $7,000. $689.14 have been met. That leaves a remaining amount of $63.10.86. And then here's the out-of-pocket max. So $13,200, $1,793.79 have been met. And so that would leave a remainder of $11,406.21 remaining. Okay. And so if you look here, I'm saying that the estimate the surgeon gave you is $2,000, and the estimate the hospital gave you is $2,500. So because you have a deductible here of $6,310.86 that hasn't been met, then this full surgeon's fee would go to deductible. So it wouldn't be any kind of coinsurance or copay. And I know that contractual adjustment is a thing, but we're going to pretend like that isn't a thing right now. And this is just the amount that the surgeon agreed upon with the insurance company. They would probably bill far more than this, but this is their amount. So $2,000 going to deductible. Now let's look at the hospital. So the hospital has surgeon fees. I'm sorry, the hospital has an estimate of $25,000. When we deduct the amount of deductible with the surgeon fees that you would have paid towards your deductible, that leaves a remaining amount of $4,310.86. So that's what's left on deductible. And then deductible paid is $4,310.86. So then we would subtract that from the out-of-pocket amount. So you would say $2,500 minus $4,310.86. gives you an out-of-pocket remaining of $20,689.14. And because up here, your hospital fee is 30% coinsurance, you would then times that amount. So you would say the amount after deductible is $20,689.14 times 30%. Gives us $6,206.74 that needs to be paid. Okay. So then you would add this together. So you would say the out-of-pocket amount, so my 30% coinsurance gives me this number. This is what I'm paying in coinsurance, plus my deductible amount gives me a total owed to the hospital of $10,517.60. And so if we look over here, our total surgery estimate was $27,000 between the hospital and the surgeon. And so if we take the total owed to the hospital and the total owed to the surgeon for deductible and coinsurance, you're going to get $12,517.60 total owed for this surgery. Let's look at another example. So if the surgeon says their estimate is $500, the hospital says their estimate is $3,000, very low, because you still have $6,000 plus remaining of the deductible. $500 would go to the deductible, so you owe the surgeon $500. And then looking at the hospital, you have surgeon fees. So you're going to take the deductible of $63,1086 minus the $500 you paid the surgeon. It's going to give you a remaining deductible of $5,810.86. So because you still owe $5,000, almost $6,000 of a deductible, this $3,000 is going to go to your deductible. And because everything applied to deductible, you wouldn't have to worry about your out-of-pocket. You wouldn't owe anything there. It would just be $3,000 to deductible, $500 to deductible. So you're going to owe the full $3,500 for that surgery. And then you're still going to have $2,810.86 remaining on your deductible. I hope that makes sense. I hope applying it to some real world situations is helping you see. So let's look at a physical therapy example. So here, again, we have $6,310.86 remaining on our deductible. So for physical therapy, you have to pay your deductible first, and then a 30% coinsurance would kick in. And remember, we have a limit of 20 therapy visits per year. So say that physical therapy, you needed 25 visits total, and they're $350 a visit. That's kind of high for therapy, but just stick with me. So some might say, okay, well, I have a deductible to meet. So let's figure out how much I owe the deductible and then how much I would owe to my out-of-pocket, the 30%. And so you might say 100, oh, I didn't change this. You might say $350 a visit times 25 visits gives me $8,750. But not so quick. Oh, and then I calculated out the deductible here. But not so quick, because remember that your plan only covers 20 visits a calendar year. So it's not going to cover those last 5. So this is going to be our actual breakdown. So $350 per visit times the 20 that they allow is $7,000. Remember, I have $6,310.86 remaining on my deductible. So I would pay this portion of my deductible for a big chunk of those visits. And then what I would have remaining, so $7,000 less the $63,1086, gives us $689.14 that would go to then out of pocket, which is 30% coinsurance. So that's $206.74 paid to this out of pocket max. So all in all, if you take the deductible amount you paid plus the amount you owed in coinsurance, that gives you the $6,517.60. And then for those last 5 visits, because you have a 20 limit max, it'd be $350 times 5. You'd pay an out of pocket or pay on your own expenses $1,750. And so if you take the deductible and out of pocket that you owe your coinsurance here, plus the amount that you're privately paying for those last 5 visits, this would be your total for 25 visits at $350 of physical therapy. I hope that makes sense. Always look at your limits because that is going to play into how much you owe. And that's the end of our webinar. I hope that applying some of those technical terms to real life situations helps you understand your own situation a little better next time. Be sure to contact us if you have any questions or drop any questions in the comments below, and I will definitely be happy to help however I can. You can always reach out to us on our website at endoforwardfoundation.com or send us an email at hello@endoforwardfoundation.com. If you need a list of those technical terms for your safekeeping and a reference for in the future, definitely send us a message either on our social media pages, through our website, or through email, and I'd be happy to get that over to you. Also, if you're an endometriosis warrior here in the DFW area, we do have a private group on Facebook where we just all connect together. Be sure to check out our Facebook page at Endo Forward Foundation, and there is a link in the pinned comments at the top for that. Thanks so much for joining me today, and I hope that you have a great day.